Hi everyone, it is World Menopause Day, and I want to take a few minutes to talk about breast cancer and menopause. Many women diagnosed with breast cancer, especially those under the age of 50, will go into premature or early menopause as a result of breast cancer treatment. Additionally, medications such as endocrine therapies, tamoxifen, aromatase inhibitors for patients with hormone receptor positive breast cancer can exacerbate some of the signs and symptoms of menopause, and it can be significant and they can be debilitating and they can impair quality of life. But there are things that we can do. A common misconception is that tamoxifen puts you into menopause, but it does not. It does not reduce the circulating estrogen levels in your body. It does not have any effect on estrogen production by the ovary. Tamoxifen is a SERM, a selective estrogen receptor modulator, and what it means is that it works as an anti-estrogen in some areas like our breast and any residual breast cancer cells that may have the estrogen receptor, and works as a proestrogen in other places of the body like the uterus, which is why you can have a higher risk for uterine cancer, uterine lining thickening, and uterine polyps. Aromatase. On the other hand, to take an aromatase inhibitor, you have to be in menopause, because aromatase inhibitors, what they do is they block estrogen production from sites that are not the ovary, like your adrenal glands or your adipose or fat tissue. If your ovaries are still making estrogen, what will happen is when you take an aromatase inhibitor, the body will sense decreased estrogen levels and will tell your ovaries to bump up estrogen production, which would be counterintuitive. And so that's why to be on an aromatase inhibitor, you do have to be in menopause. And for our premenopausal women at diagnosis, if an aromatase inhibitor is recommended, then menopause can be achieved either with surgical menopause, which is removal of the ovaries, and we typically remove the fallopian tubes with them, or with chemical menopause with drugs like Lupron or Zoladex. Let's take a minute just to talk about what are things that you can do to manage some of the menopausal side effects, especially if someone is not able to take hormone replacement therapy. When we think about menopause side effects, we're thinking much more than are hot flashes and joint pain and mood changes, but those are a big part of it as well. We're also thinking about the genitourinary syndrome of menopause, which is much more than just vaginal dryness. We're thinking about musculoskeletal health, we're thinking about brain health, cardiovascular health, bone health, and then these are all really important side effects. So what are 3 things that you can do? Number 1, for the genitourinary syndrome of menopause, vaginal estrogen is a really good option. It has very limited, if any, systemic absorption, and guidelines do allow for the use of vaginal estrogen in patients with hormone receptor positive breast cancer. So definitely talk to your doctor about that. If that's number 2, exercise is so important. It can help with brain health, it can help with bone health, it can help with musculoskeletal health, cardiovascular health. Now, I know that sometimes when you are not feeling well and you're experiencing those menopausal side effects, exercise can be really, really hard. Start slow, go for a short walk, maybe do some even chair yoga, swimming if you have access to a pool, but that low impact movement can be a great place to start. And the recommended guidelines are 150 minutes per week. But if you're not there, that may seem intimidating. So start slow, work your way up, and see what you can do. Finding an accountability friend or buddy can be really helpful in starting to get some of that movement in. Number 3, talk to your healthcare team about managing some of these side effects. So how do you optimize your cardiovascular health? How do you optimize your bone health? How often should you be getting bone density scans? Do you need to see a cardiologist based on the treatment that you received? Those are some of the questions that I want you to sit down and talk to your healthcare team about, just to make sure that you're optimizing everything that can be optimized. Let me know your questions about cancer, menopause, leave them in the comments.